and playground near the service area. When the queue is approaching, a notification will be sent to their smartphone. Smart medical device such as thermoscan, infrared vein viewer for health puncture, vital sign monitoring will link data from medical device to health information system. E-prescription. Doctor can prescription via health information system and cancel prescription in paper form. Electronic health record and personal health record. Patients can see their health data via mobile application Health for You for see their personal health record. RDU application provide information, knowledge, and understand the use of psychiatric drug. E-payment. Patients can pay by use payment kiosk, scan QR code, or use EDC. Telepsychiatry. Used for improved accessibility of psychiatric service. The target group of telepsychiatry are outpatient, inpatient, forensic psychiatric patient, school mental health, and community mental health. E-satisfaction assessment. We use such survey by scan QR code at the service area for patients to assess the quality and satisfaction of the service. Chatbot. We use the chatbot to provide mental health service information. Each psychiatric hospital has its own chatbot to provide service information. And we have alternative digital innovation such as robot pharmacy, drone delivery, AR, VR, and other digital innovation. Drone delivery at Korea, Lad Nakalin is still used drone for delivery, deliver drugs to each psychiatric ward within the hospital, as each of them are very far apart. AR, VR, augmented reality, and virtual reality. At Korea, Landa Clinic still use AR, VR to help in diagnosis and treatment for specific phobia. Step 4, evaluation. The effectiveness and efficiency of digital development are assessed. We evaluate the performance of the digital master plan of each psychiatric hospital. Queue management system can reduce waiting time in every psychiatric hospital. And robot pharmacy can decrease drug dispensing error from 14.8 per 1,000 prescription to 7.57 per 1,000 prescription. Mobile application in mental health service be applied for screening mental health problem in community setting and psychological first aid for the lead group. Mobile application in mental health service be applied for screening mental health problem in community setting and psychological first aid for the lead group. Example of mobile application and mental health checkup, mental health check-in, hero, and sati. Mental health checkup used for all people. Mental health check-in used for specific objective. Hero used in school mental health and sati used for the volunteer to deep listening to the people with mental health problem. First, the mental health checkup. It is used for self-assessment for mental health status. It can check up the mental health status in 6 packages with composed of state checkup, depression checkup, dementia screening, emotional quotient checkup, resilience quotient checkup, and Thai happiness index. Mental health check-in. We use it in specific objective and specific function. It used for assessment for major psychiatric problems with call in abbreviation as SBSD assessment. S is state can screen by 5 questions. B burnout can screen by 1 question. S suicide can screen by 8 questions, and depression can screen by 2 questions. If positive, we will follow screen by 9 questions. Mental health check-in now we used as the major mobile mental health service in COVID-19 pandemic situation. It used for combat with mental health problem by screening SBSD in state quarantine and local quarantine. It can use as self-assessment for health personnel assess the risk group, screen the people in the community setting by health volunteer. The dashboard can show the mental health status of Thai people in each province and in specific settings such as state quarantine. When we find the people at it, we will have the helper team to call back by telephone for counseling or provide psychological first aid. The next, Hero application. Hero application is health and educational reintegration operation. It used in school mental health service for surveillance the behavior and emotional problem in students. Learning the behavior modification and counseling technique for teacher. Early intervention for the risk group from screening. Consultant with the specialist. We have clinical psychologist available to be consultant and refer to psychiatric service. The last one is Asmile Connect. It is the Livebot application which we apply as portal of all mental health service. All patients can appointment online for every psychiatric hospital through single channel chatbot for provide information and use as digital mental health literacy. Digital mental health in the level of department. We are in the process of data governance to make data to be accuracy, completeness, consistency, timeliness, relevancy, availability, authority, and security. The process of data governance composed of improve data catalog, data quality, data security, and data privacy. Mental health data center set up data from each psychiatric hospital be sent to health data center and Department of Mental Health Data Center and show summary in dashboard. We have data exchange between Department Operation Center of Department of Mental Health and Health Data Center of Ministry of Public Health and show in dashboard. This is Executive Information System. The dashboard for Executive Board to assist in decision making. In conclusion, the main point of my talk, digital mental health service in Thailand can improve experience of psychiatric patients in psychiatric hospital and people with mental health problems in community setting, can increase accessibility, reduce the waiting time, decrease the service process, and improve patient safety. And I will finish my presentation with video clip of Smart Psychiatric Hospital in. Thank you very much for your attention.
Thank you so much, Wisak. That was a fascinating presentation. And I think what I drew from that was the huge amount of work that you and your colleagues in the Department for Mental Health are doing to not only establish but expand the range of digital mental health services that are available to the population of your country, and a really impressive portfolio of work that's being undertaken. Really tremendous. And I think that a couple of things that I think I really noticed was particularly in relation to your mental health checkup app. I noticed that it included some opportunities around dementia screening, which is tremendous. I think a lot of our focus today, and inevitably, is often around mental health digital provision for adults. I mentioned in my own presentation some work that's targeted around children and young people in the UK, but very often I think we neglect the thinking around how we can make these services accessible for older people who experience mental health problems, and particularly people who may be at risk of developing dementia, whether they be older people or indeed early onset dementia. So it was tremendous to see that. And I think that at the very end of your presentation, you helpfully focus down on a number of really key areas that this work is trying to address and take forward. In particular, I think the improvement in patient safety, the reduction in waiting times, and the increase of accessibility to services, really, really important. And I know that there are challenges, not just in Thailand, but in many other parts of the world, and not just in lower middle income countries, but indeed in many high income countries, of attracting professionals into mental health services to work within them, and particularly around clinical and medical staff, the provision of psychiatry and other support services. So alongside that workforce challenge, digital can, I think, help to bring some particular benefits to improve accessibility where there are workforce challenges. That's not to replace the need to address those challenges, but again, to complement them. And I think that's a theme that has come out today. We have about 15 minutes or so left of our time if we want to use it, and if there are questions that people would like to ask. I can say that the presentation are going to be available online. That is a question that's been posed in the chat, so you will be able to, I think, watch back and also download the presentations. There is a question that's come in, and I think I'd address it to you if I may, Wisak. It's about how you're linking your data and digital health development plans with what private sectors and other non-government providers are doing. Is there any information you can share with us about that linkage between what's happening within government and what's happening within commercial sector development? I don't know if you're best placed to answer that question. Let you have a look at it first. I think there's also a follow-up question about what you see as being the biggest challenges that you face in trying to develop digital mental health. Perhaps that might be a good place to start.
The question about to link data and health development plan with the private sector. Now we have digital plan in only in public sector, and in the future we will link in private sector.
That's helpful. Are you able to share with us any of the challenges you're experiencing and how you're trying to overcome what are some of the difficulties perhaps that you're trying to overcome, and whether you have any ideas that you can share with us about what you're doing that others might learn from?
The question is all data in the public sector will integrate and link and can exchange data between the public sector.
A couple of other questions. The first is about whether people who are not native to Thailand but living there will have access to these digital services. And whether the services that you've described in your presentation are going to be available or are already available nationwide, or if they're just in particular parts of the country.
Now we translate at in mental health check-in, we translate in Myanmar language to help screening Myanmar level in Thailand in COVID-19 situation, and in the future will translate in other language.
I think there are also some questions about whether or not people can get in touch with you and your department so that they can learn a bit more and potentially some research work that's going on. So I'll leave it with people, I think, to make contact with you directly or to follow up as a result of this webinar. I'm sure that there'll be opportunities for people to reach out to you so that you can share some of your developments. Seeing if there are any other questions coming in that you might want to respond to. I think the last one was about the spread of your innovation, whether it was confined to particular geographical areas of Thailand or if it is countrywide.
In research area, we can support the data from mental health screening in the database.
Terrific. There's a question that's come up which is pertinent to the UK, so perhaps I might take moderator's privilege and attempt to answer that. And the question is about how, in addressing wider inequalities, what examples in the UK are there to ensure that accessible digital information for people with disability? I mean, I think that that's a very important question, and I did touch on that at the beginning in terms of the accessibility of services. There has been, I think, over the years, a drive to improve telehealth more broadly, but I would say that uptake has been a little bit slow. It's a personal observation, and I think that there's a huge amount more to do to make digital information for people with disability as accessible as possible. It's perhaps an opportunity for me to promote an organisation called the International Initiative for Disability Leadership, which is a sort of companion organisation to the one that I work with on mental health, which works across 8 different countries and provides knowledge exchange in relation to disability matters. And actually one of the really important issues that network is thinking about all the time is accessibility of services, and in particular, how people with disability are able to access digital services, with a particular focus on people who have visual impairment or hearing impairment, and that's a particular challenge for those who are trying to use online video conferencing in particular. I think there's a huge amount more for us to do to expand accessibility, both in terms of affordability and access to the technology, but also to make that technology as user-friendly as possible. So I think the UK has lessons to learn from other places, as well as some examples of work that's going on. I'm not sure that Richard is still on the call. If he were, then I would perhaps ask him if he had any examples from his work within the Academic Health Science Network, but I think he may have had to leave us. But that may be something that we can follow up with him separately through Kuka's good connections. There's another question, and I don't know whether, Thwisak, you're in a good position to answer this. It's what are the measures of mental health digital services for those persons with disabilities in getting such services? You mentioned some outcome use that information to further develop digital services.
The data from digital service as in mental health screening, we when have very good from the screening, we have help a team to develop back to them to counseling and provide psychological offer that. Okay. And the question about the digital mental health to support the person with disability, I think now it have limitation of the application in the first step, and I hope in the future we will support all the group and people with disability.
Thank you so much. Can I also remind all of you that there's an opportunity to provide feedback through the evaluation form, which I think you will have been sent when you registered. So can I please encourage you to provide responses and feedback through that evaluation form. It will be really helpful in enabling the organisers to understand how well today has gone, but also what improvements or others they might make. I think you can see also potentially on the screen there's a QR code, I think, which will enable you to access that online as well. So please do take the opportunity to do that. So in closing, can I firstly thank our speakers for the excellent presentations that they made. We're most grateful to you for taking the time to prepare so thoroughly and to present so well to us today. Can I also thank colleagues at the British Embassy who helped me in particular in thinking about the organisation of today's event, for inviting me to moderate it, and also for the opportunity to undertake the work with colleagues within the Department for Mental Health on this important subject of digital mental health. In conclusion, it seems to me that there are not only some great examples of some fantastic work happening across Thailand, but some real ambition to take this forward, real aspiration to make it a success, and a real drive to really improve both the range and quality of digital mental health services, to do that within a context of improving accessibility for people, but also getting the key importance of quality and accessibility and improvement in promotion messages as well as treatment services. So it's been an absolute pleasure to be with all of you today. I hope that you have found it a very helpful session, and I think there is going to be a short video presentation before you all leave us, so can I ask you to stay for that? But thank you all for your time and attention. It's been a pleasure to be with you, and there will now be a closing video presentation. Thank you all very much.
เดี๋ยวพวกเรานะคราวหน้านะเวลาไอ้ประชุมอย่างเงี้ยนะมันคงไม่ใช่เป็น opening ceremony มันคงเป็นแบบ opening remarks ธรรมดานะไปนะ